Hi, Linda Frank, University of Pittsburgh School of Public Health. I just have a question for the panelists. As someone who does education myself and as a clinician, I think one of the challenges is being able to demonstrate documentable, specific outcomes. And before we get into sort of a group think about training programs, one of the challenges, I think, is coming up with measurable outcomes of interventions around education. Because here in the United States and in international programs, there's more focus on, yes, we'll give you the money, but can you show me documentable outcomes beyond testimonials of, we liked the program, we got a lot out of it, we can do things better, etc. I'd like to hear the panel respond to how they're thinking about measurable outcomes of educational intervention.
Great.
I can try and start. I think it's a very important question because doing these kinds of things, if we only do them because they seem like a good idea, we're going to end up doing a lot of things that aren't a good idea. So we actually have to prove that we're achieving what we want to achieve. The question is sort of what kinds of outcomes do we want to measure? Ultimately, we would like to show, for example, with our pathway program for the residents, that ultimately it leads to career choices that involve serving the underserved. I'm sort of saying this is a lofty goal. And in order to measure that difference would take a long time. So we try and pick a surrogate measure. So we are measuring that. A couple of surrogate measures of interest that we're measuring. One is the hospital is very interested in demonstrating that we're meeting the needs of the medical student applicants to the program. So we anonymously survey applicants to say, wow, is hearing about all this exciting to you? Sure. And then we believe that these types of programs contribute to resiliency and professionalism amongst our trainees. And there are actually validated instruments for measuring burnout, resiliency. There's not one for professionalism yet, but, and so we're measuring that yearly in our residents as well. Ultimately, for a program to be beneficial, you'd want to measure some effect of sustained change, and ultimately, we'd love to show that we're making a positive impact on health. Those are harder things to measure when you're trying to use an educational program for 8 people as an intervention. Mm-hmm. So we do the best we can to measure that what we're doing is moving us in the right direction. Does that help? So there's sort of the process outcomes, and then there's the outcomes.
And it's hard to determine as an educator, what are the intervening variables?
Sure.
Did your educational program really make the difference? Mm-hmm. Or was it because somebody, a clinician, talked to an influential, they learned something from their patients that made them change the way they practice? I mean, there's a whole lot of problems with, sort of a linear model of figuring out, what actually happened. I don't have the answer, but it's something that I think all of us, as working in this field, really struggle with.
Well, I think the competency-based objectives allow you, in theory, different domains to measure, at least amongst the trainees, their acquisition of knowledge and skills. So that's something you can measure.
Any other comments? Yes.
When we're focusing on the pre-departure preparation and the students, I didn't mention it in my presentation, but we were going to do assessment of just how much content they learned before they even went, using the modules that we'll design, just doing learning assessments, but then also asking them to provide documentation of the ways in which they did apply the principles that they learned once they've come back. So really, what did you do about, say, sustainability? How did this affect what you've done?
So new that there are kind of lots of concrete metrics that we can use to show increasing capacity, number of students that come through, number of students that come through and graduate in a timely manner, number of courses offered, different funding sources. The University of Namibia, just like most universities is going to need diversified funding sources. Sustainability of staffing. So all of those are shorter term metrics, but we are using them to kind of gauge the strength of our project.
Okay, great. The gentleman in the green shirt, I think, had his hand up a long time ago. This is a fascinating topic, and I think we need to do more about it, and hopefully a lot of you will come up with an answer for the next year's meeting in Montreal. Okay. Please.
Well, thank you very much. My name is CUGH2010. Until recently, I was in Makerere University, and I've just shifted to the Northwest. I spent 15 years as a university teacher and researcher doing the type of thing you're doing here, and I find it quite interesting. Now, one of the things which has interested me in the short term in the Northwest is that a good number of the indicators we see in the developed countries are also visible in America here. Last week, I attended a meeting at the Seattle State Lab, and the presenter was presenting that very few miles from Seattle, there's some communities which have indicators similar to Nairobi. And now this is now an opportunity. Now my question is that for those of you who go to countries there in Africa, when people acquire the experience there, are they available or to prepare to give culturally appropriate services to the immigrants or people in Africa who live in Seattle? Let me put it, I don't know that it is clear. There are so many this is King County, Pierce County. We've got so many people from Uganda, where I come from, Somalia, and whatever, and they've got poor health indicators. So now that you have gone outside, is there a program to work out, to give out the indicator so that at least when I know that I come from Uganda, I know that I'll go to UW, ITech, because they know the type of things which I face back home. So that's what. And secondly, about the funding, my experience from Uganda, these things are very expensive. Are there people who are willing to fund so that's sustainable for a number of years to come? Thanks very much.
Thank you for that question. Who would like to answer that one?
Can I take the last part? So the last part, why this program that I talked about, the EnviroVet, has been able to go on year after year and take on all these students, and you know so many came from other developing countries, is that the students, and sometimes they're already veterinarians and biologists and ecologists, they, from the developed countries, are asked to pay the full fee, but the board of directors works very hard to raise the money to cover all the costs for the students and professionals that come from developing countries or lower income countries. So yes, fundraising is a really important and challenging issue, but so far they've been very successful.
Great. Any other comments?
We actually, it's very interesting you mentioned that, because one of the clinics that Seattle Children's residents rotate through actually serves a lot of refugees. And many of those refugees are from Somalia originally, and actually are from Kenya, and are speaking Swahili because of the time they spent in the Kenyan refugee camps. So, and part of, we really engendering understanding for the refugee plight for those who are coming from, a lot of them from East Africa, and right here in Seattle is part of our local global health part of our curriculum. So we send them, for example, to resettlement agencies and to understand better what are the services that are there or are lacking for these folks, as well as some of the local community resources for these populations. So I think I think you touched on a really good point, that looking at the local global health issues, the vulnerable populations here in our own state and country is definitely needs to be part of the curriculum.
Great. Thank you very much. Let's take a last question here on the left, and we should stop on time.
I had one, yeah. Thank you. Back to Mary White from Wright State University, Boonshoff School of Medicine. This was an outstanding panel. Terrific. Thank you so much.
I'll keep them for another half hour.
Okay. Just the assessment question got me thinking. In your work with your global health partners, what kind of ongoing evaluation is being done to make sure that they, in turn, are satisfied with the partnership and the activities in which you are engaged? How do you do that kind of assessment? If I respect the difficulty of assessing a long-term benefit for our residents and so forth, but it may be quite possible to inquire about our partners, and their goals may be quite different from what we might think. And how do we do that?
Well, that is, I think, the key, probably the key piece of work for the last 2 years has been working on the partnership. It's so obvious why our program is good for our residents. It's so obvious why it's good for our hospital. It's so obvious that it's a small, relatively speaking, in the operating budget of the hospital, a small cost. And for it to be a partnership, a true partnership, it would be mutually beneficial. The best way to be mutually beneficial would be as if it was a bilateral exchange. And that's what we're working towards. We stumbled a little bit with the bilateral exchange when we talked about bringing physicians to train with our residents, because we had this mindset of, well, they'll come and they'll, go to clinic, and they'll, like residents who go from here to abroad for short-term medical electives usually engage in clinical activities. And we stumbled because it's very hard to get hospital administration and legal to allow that to happen. But we had a sort of aha moment in our quarterly evaluation of the program in Kenya with our partners, when the residents there were saying, it's not the clinical prowess of your residents in managing ECMO that's bringing something to our program. It's this curriculum on public health, social justice, communication for health promotion, writing, and access to mentors to guide our career. That's what we're missing. So we're talking about trying to bring them for that curriculum month to be a part of that. And that gets around the whole logistical mountain that we were trying to climb over, which wasn't really relevant anyways. So it's just, I think it highlights your question as being the key thing to making this work, is ongoing talk.
Ongoing. And with that note, this program is really ongoing. Yeah. But I'd like to thank Richard Gunning and Dr. Conrad, Dr. Suzanne Peck-Gorstein, and Dr. Donna Dino, Dr. Manesh Batra, Dr. Gabriel O'Malley, and Julie Muslowski. Thank you very much.
Thank you very much.
Thank you all.